Congratulations on having a baby. We know that the birth of your baby is a special, unique event, and we want your experience to be one filled with special memories. Where you choose to deliver your baby can shape your journey into parenthood, and Kadlec has created its birth center with you in mind. It's family-friendly, has open visiting hours, private rooms, and excellent nurses providing excellent care. You can also have extra peace of mind knowing the area's only Level 3 neonatal intensive care is just steps away, ready to provide the highest level of care for your baby if the need arises. Each year, nearly 3,000 babies are born at Kadlec, and each one is special. We're excited to be a part of your baby's birth, offering you all the options you want with the care and safety you need. As your big day approaches, we know that being familiar with our birth center will help you feel more comfortable, prepared, and relaxed. This video is designed to walk you through the process of having your baby at Kadlec. Kadlec Birth Center is located on the second floor of the Orchard Pavilion, which is the 4-story building facing Swift Boulevard. When the time arrives, if you come to the hospital between 7 a.m. and 7 p.m. on weekdays, free valet parking is available at the Orchard Pavilion entrance on Swift Boulevard and Stevens Drive. If you arrive after 9 p.m., please use the emergency department entrance, which can be accessed off of either Swift Boulevard or Goethals Drive. Through the ER entrance, follow the Main Street signs to the Orchard Pavilion elevators. Take the Orchard Pavilion elevators to the second floor. The Kadlec Birth Center will be on your left. As you enter the birth center, you will be welcomed at the front desk by members of our birth center team. Upon check-in, you will be escorted to either one of our 4 private exam rooms, 4 antepartum rooms, or 18 labor and delivery suites. If you're scheduled for an induction, you can expect a call from the birth center to provide you with the information about when to arrive. This time will be flexible, depending upon the availability of staff and suites to comfortably and safely deliver your baby. The majority of moms will begin in an exam room for an assessment of labor. You may be under medical observation here for a minimum of 2 to 24 hours to determine readiness for admission. Our 4 antepartum rooms are for admitted expectant mothers who are receiving care for an extended period of time but not yet ready for delivery. Once you are admitted and ready to deliver, you will be escorted to a private labor and delivery suite. These suites combine state-of-the-art technology with a comfortable setting. They offer many amenities to make the birthing experience more comfortable for the mom and family. Our labor and delivery suites have specialized beds for delivery, fetal monitors providing constant information on your baby's heart rate and frequency of contractions, a warmer for the baby, a closet for some personal items, couches or chairs for family and friends, including a sleeping chair, a refrigerator, a personal thermostat so you control the temperature of your room, a bulletin board for communication with your care providers, and private bathrooms with either a shower or jacuzzi tub. In the event you should need a cesarean section, the birth center has a dedicated operating room staffed with OR-trained labor and delivery nurses. One person of your choice may be allowed in the operating room during uncomplicated surgeries. For your convenience, there are 3 nurses' stations located throughout the birth center. If you need assistance anytime during your stay, we encourage you to use your nurse's call light on your bed paddle. Since no 2 mothers have the same response to the pain of labor, and since no 2 labors are exactly alike, our team works to meet each mother's pain control needs and wishes. Our dedicated team is here to help make your labor as comfortable as possible. If you choose a natural birth, our nurses will guide you through the process. If pain control is requested, our obstetric anesthesiologist and nurse anesthetists are dedicated exclusively to the hospital's birth center. They're available 24/7 to help you navigate the various options for keeping your pain to a minimum, including IV medications and epidurals. During labor, you will be on a clear liquid diet. After delivering, you may be very hungry, and we have food available, from complete meal service to light snacks and sandwiches, depending upon the time of day. If you have questions about meal service, feel free to ask your nurse. Once your baby is born, we encourage you to have your baby room in with you to promote bonding and help establish optimal feeding practices and nursing routines. We have lactation consultants available to assist you with breastfeeding 10 hours a day, 7 days a week. Following discharge, these specialists can also be contacted to help ensure your breastfeeding success. We will encourage skin-to-skin contact in the care of your newborn. As soon as possible after your baby is born, he or she will be placed skin-to-skin with mommy. The birth center has a security system in place for the baby's safety. You and one other support person will be given an identification bracelet when the baby is born. We will be checking the numbers on your and baby's ID bands. We also have an electronic infant security system for added safety. After delivery, some moms may be moved to one of our private postpartum rooms designed to help new moms recover in an environment that is family-centered and comfortable. These rooms have many of the same amenities as our labor and delivery suites. They're located in a quieter area of the birth center, which allows moms and babies to bond and rest. They have a dedicated nurses station centrally located for the convenience and comfort for new moms. Should your baby need transitional newborn care or a minor procedure, we have a nursery available within the birth center. Throughout your stay at Kadlec Birth Center, families and friends are always welcome. There's a waiting room with a restroom available to the left as you enter the birth center. Family members and guests may utilize the Family Nourishment Center located on the unit, which includes coffee and other beverages. They may also order from the guest menu for a fee. Before leaving, you will receive a souvenir birth certificate, a worksheet for the state to initiate a Social Security number, and the opportunity to fill out paternity papers if needed. We can also provide a notary should you need one. You will also watch 2 videos on mother and new baby care and shaken baby syndrome. We will also help you schedule your free postpartum clinic, which typically takes place 24 to 72 hours after discharge and is staffed by birth center nurses experienced in after-birth care and breastfeeding. During this clinic, the nurse will check baby's weight, look for signs of jaundice, and assess breastfeeding progress and provide assistance as needed. C-section staples may also be removed at this time. Your baby will be expected to eat during the postpartum clinic to better assess feeding, so please bring your baby ready to eat. Outpatient circumcision clinics are performed every Tuesday by a hospital-based pediatrician. The appointment can be set up at discharge by calling the pediatric unit and must be done before 30 days of age. Ideally, you will have chosen your baby's pediatrician before the birth of your baby and confirmed that this doctor is accepting new patients. You will need to set up your well baby check according to your pediatrician's guidelines, usually 7 to 14 days of age. If you've not yet selected a pediatrician for your baby, there are numerous doctors in the community accepting new patients. If you would like a Kadlec Clinic doctor, call 509-942-DOCS, and we can help direct you to a clinic near you. Please also obtain a car seat for your baby and review instructions on its use and installation prior to arrival to the hospital. At the end of this video, we've listed a number of resources, including what you should bring with you to the hospital and links to sites that you might find helpful during your delivery process and after your baby is born. Take a few minutes to review the resources. Your doctor also has copies of the Kadlec Birth Center brochure, which includes additional information. Be sure to ask for one if you haven't received it yet. Copies are also available at the birth center. We wish you all the best as you prepare for your baby's arrival. Thank you for trusting Kadlec Birth Center. We are honored to be a part of this important time in your life.